How do you sort through the almost infinite stream of information on the internet to find the facts when it comes to addiction treatment? Having an addiction is hard enough, but with a bunch of outdated and just flat out wrong information out there, people often feel shame and embarrassment when it comes to their situation. It's super important to talk about addiction openly and honestly, and that's the path to a better life. So we're here to break down some of the big myths surrounding addiction recovery. Addiction myth number 1, drug addiction is a choice. You could just stop if you wanted to. This is probably one of the biggest misconceptions. In fact, leading authorities on addiction agree that substance use is a chronic disease similar to heart disease, diabetes, and cancer. That means that it's not something that can be fixed with a magical snap of the finger. Sometimes it's connected to your genetics, the environment that you grew up in, or some trauma that you went through. And usually it's a combo of all three. It's a biological, psychological, and social disease. And it takes a whole support system and lots of time to get through, which leads us to our next myth. Addiction myth number 2. Once you receive treatment, your journey with addiction is over. Addiction treatment isn't like that history lesson that you memorized right before the test and then you completely forgot. Recovering from an addiction is a lifelong process. You need sober friends, a sober community, and new coping mechanisms. Not using is really just the start of recovery, just as important as addressing the underlying why behind using in the first place. Like general health, 28 days of working out won't get you swole. True health comes from making a lifestyle of healthy choices. Addiction myth number 3. Relapse is a sign of failure. This one hurts people a lot. 40 to 60% of people who get substance abuse treatment will relapse within 1 year. They should know that their relapse is a natural part of the recovery process, not a sign that they failed. Changing habits can be hard, and having a mental and a physical dependence on something makes it much harder. No matter if you have been sober for 10 days or 10 years, a relapse isn't starting over. All those sober days, they still count and they still matter. Addiction myth number 4. You must hit rock bottom to have a successful recovery. You don't need to have cavities in all of your teeth before you're able to effectively brush your teeth. Addiction treatment is the same way. Catching an addiction early on is super beneficial, and the easiest way to know when you need help is to listen to the people who know you, who love you, and who can talk openly and honestly about your substance use. If substances are controlling your life or getting in the way of the person that you want to be, then it's okay to go sober. The key to a successful recovery program is being engaged and willing to change, not having nothing to lose. Addiction myth number 5. There is a one-size-fits-all treatment for all addiction. Everybody uses for different reasons. We have unique trauma and experiences, and all of which paint the picture of why we started using and why we will stop. There's no magic therapy that helps everyone. There's no one medication that makes it easy for everyone to get or stay sober. The more specific and unique a treatment program can be to you and your situation, the better. At Sandstone Care, we get that. Talk to us, reach out, call, go to sandstonecare.com or give us a call using the number in the description box below. We'll get to know you and your specific situation and connect you with the support that you need, even if it's not with us. Change is possible, and Sandstone Care is here to help.